So again, my name is Jeff Abramo. I'm Communications Director here at AARP New Jersey.
I'm Brian McGuire. I'm an Associate State Director for Advocacy here in New Jersey with AARP.
And Brian does a lot of the work within New Jersey as it relates to federal advocacy, correct?
Yeah, that's right. The whole range of issues. Right now, of course, we're very concerned about what's going on with Medicare, Medicaid, and the Affordable Care Act.
Now you may have seen on Facebook, I'm sure you see at the very top of this page right now, there's something about age rating. We've been speaking about Medicare. There's a lot going on right now, and one of the reasons why we wanted to have this discussion about Medicare is just because a lot of these issues that you're hearing about are kind of connected in ways that maybe you would or would not know. So hopefully we're going to talk about this a little bit. We'll give you an opportunity shortly to submit some questions. But hopefully after the end of this, you'll understand a little bit more about the current issues, current state of play, how things are connected, and maybe what you can do.
That's right. And so what we're going to talk about is, first of all, Medicare, a real concern we have about this proposal to make it into a voucher program. Second, as I said, the Affordable Care Act, number of aspects of that affect people on Medicare as well as people that are younger than that, of course. And then Medicaid. A lot of people don't know much about Medicaid. They don't think that's something that would ever impact them at all. But in fact, as we'll talk about, it's a major safety net for older people who need long-term care.
Yeah. Now, vouchers. Vouchers is a word that we've heard tossed around with Medicare, for as long as I can remember. And I know that it's coming back now. The word, a lot of discussion about vouchers. What exactly is a voucher when it comes to Medicare?
It's important to think about vouchers compared to what we have right now, and that's Medicare. If you're on Medicare, you know anything about Medicare, it's insurance. It's health insurance. You can see in your benefits packet, what it covers, what kinds of services it covers, how much you have to pay out of pocket for those services. It's insurance. It's good insurance for people that are 65 and older and people who are disabled. And so what a voucher is it's not insurance. A voucher is simply a coupon or something that you can use toward the purchase of health care. And so changing Medicare from a guaranteed benefits program where it's insurance, you know what it is, you know how much you're going to pay. A voucher system really is telling folks that you're going to go out on the market and find your own health plan, and there will be a voucher of some value that will help you do that. We're really concerned about this for a number of reasons. Number one, it changes Medicare in that there's no more guaranteed benefit that's been there for 50 years, where again, you can rely on that benefit, a benefit that you have worked toward your entire life through paying the Medicare payroll tax. Instead, this voucher program, what it is just some financial assistance of some measure that's not actually clear that will help you purchase health care on the open market. The concern is, first of all, that how much is that voucher actually going to be worth? In other words, if you get a voucher that's worth $5,000 a year and you're out there on the market and you're looking at plans that might range from $10,000 to $15,000 a year, you're going to have to come up with a difference. And the concern is that it's not going to be adequate. People are going to be paying more out of pocket. And over time, it's very clear to us that the value of that voucher won't keep up with the cost of health care. And people will be either forced to purchase plans that they can't afford or pick a plan that really doesn't meet their needs, has high deductibles and such.
Okay. Yeah, so it's definitely something we need to pay attention to right now. Cassandra, our screener, is here, and if you have any questions, feel free to type them in, and Cassandra will hail us if there's a question that we need to get to, and we'll be happy to answer it. And like I said, if you're watching this taped in the next couple days, we'll be checking back in, and we'll be answering those questions as they come up. So talk to me a little bit more now about AARP's position on protecting Medicare. What are we hoping to accomplish right now?
And that's really been a mission for AARP for the last 50 years, protect and strengthen Medicare and Social Security. What people appreciate about Medicare is that they know it's going to be there for them for the rest of their life, usually after they retire. They know that the cost sharing is going to be reasonable. They know, that their premium and their co-payments and such are going to be there. But mostly it's guaranteed insurance. You shouldn't have to tell people to try to figure out, the healthcare plan that's best for them. That's a really complex decision, actually. Anybody who's had a chance to pick from a whole bunch of healthcare plans knows it's apples and oranges and bananas, and you've got HMOs and PPOs and such. And just to ask people to go out there and figure out for themselves what's best for them, it probably isn't going to work very well. But more importantly, again, for healthcare for people of all ages, it's a matter of cost. and it's the cost that people are concerned about, that our members and others are concerned about, and we're quite sure with the voucher system that cost will go up a lot. We don't know how much, but it's not going to be, it's going to cost a lot more, and we're quite sure, at least over time, you'll get a lot less.
Right, I know that during his campaign, President Trump committed to protecting Medicare, correct?
He did, and that's really, really important. And so our message really is to President Trump is to keep your promise. We appreciate the fact that you have said that you're not going to do anything to harm Medicare, current and future beneficiaries. We appreciate that very much. Stick to that. And we're asking members of Congress to follow the president's lead and avoid any effort to cut Medicare, particularly ways that maybe aren't as obvious, like this voucher system. It sounds like, oh, we're modernizing Medicare, we're reforming Medicare. Well, when you really get into it, understand it, it's not that.
Right.
And if we can defeat this voucher proposal, there will be other proposals that will mostly, honestly, focus on shifting costs away from the federal government, from the Medicare program, onto beneficiaries. And we know a number of them that could occur, and they could cost folks on Medicare hundreds or even possibly thousands of dollars a year.
Okay. And I know that when it comes to this whole campaign to protect Medicare, there's some very constant messaging that really AARP undercuts everything that we're doing on this issue.
Yeah, absolutely. Medicare is a guaranteed benefit that people earn. I have members come up to me and say, well, I've paid payroll tax my entire life. I've been paying my premiums. And so now that guarantee is gone, and that's actually the fact. The guarantee is not there. People have earned this benefit, and they deserve to have their benefit. The promise of Medicare needs to be maintained. And Jeff, people can't afford more costs. The average person in New Jersey who's on Medicare has an income of about $24,000 a year. 1 in 6 of those dollars on the average goes toward health care. Younger folks watching may not realize Medicare is not free health care. Again, and people pay Part D premiums, Part B premiums. They pay co-payments and deductibles, and it costs several $100s a year.
And you're saying some of these could go up under this new plan?
Yeah, under a voucher system, it absolutely would.
And I mean, here in New Jersey, I don't know about you guys, but this is not a state that I can afford to pay more on anything.
Yeah, absolutely. And the healthcare costs are here as high as anywhere in the country.
Yeah.
Absolutely.
So, earlier you mentioned some other current events going on right now about the ACA.
Yeah.
And I think that it's important that we touch upon that because, again, there's a lot of connection between the ACA and Medicare. We've heard Medicaid. Some people don't even necessarily know what the difference in that is. Maybe we can touch on that briefly.
Yeah, absolutely. And a lot of folks don't know. AARP has been out there, of course, for decades. But when the Affordable Care Act came before Congress, we fought for a number of things that improved health care for both people that are on Medicare and people that aren't on Medicare yet. And for people on Medicare, it's important. Under the prescription drug plan, if you're not on Medicare, you might not know this, there's actually a coverage gap called the donut hole with Medicare prescription drug coverage. And there's a time when there's insurance, and then there's a gap of about $3,000 in out-of-pocket costs, where the insurance coverage goes away, and then it comes back if you have more costs than that in a year. And so what we did under the Affordable Care Act is we were able to get funding directed toward closing that gap. And in fact, right now, because of the Affordable Care Act, the coverage gap or the donut hole is actually going to go away completely in just 3 years. So that's important. Preventive benefits, screenings for people to make sure that they don't have prostate cancer, ovarian cancer, for instance. Those are now benefits under Medicare that came with the Affordable Care Act. Those are benefits that don't have actually any co-payments associated with them. Also, there's an annual wellness checkup now under Medicare that people take advantage of. That's huge. Jeff, really importantly, what the Affordable Care Act did as well was it directed funds toward the Medicare Part A trust fund, and that's just the trust fund that covers hospital coverage. And when the Affordable Care Act passed, the hospital trust fund was actually very close to going bankrupt, not having any money in it, really causing a problem, obviously. And so the money that was directed toward hospital care through the Affordable Care Act to Medicare is actually extended the lifetime of the hospital trust fund many years. In fact, right now, the hospital trust fund is solvent for another 11 years. So these are really critical points that matter a lot to people that are on Medicare.
On Medicare right now.
Yeah.
And I know that the ACA also has some real benefits to folks who will be on Medicare very soon, 50 to 64 year olds.
Yeah, and these are huge. You know, before the Affordable Care Act, depending on what state you lived in, an insurance company could charge someone, say 60 years old, 5 or 10 times as much as someone who's 20 years old. And what the Affordable Care Act did is it said, no, we're not going to do that anymore. It's going to supersede the state regulation. Older folks can only be charged 3 times more than younger folks. This has meant thousands of dollars in savings for people 50 to 64, right, for instance. And right now, under what's being proposed in Washington, they would change it from 3 to 1 older to younger premiums to 5 to 1. And for an average 60-year-old, that would be about $3,000 a year.
So $3,000 a year more if they change from 5 to 1 to 3 to 1.
Absolutely, and we estimate that going to a 5 to 1 instead of 3 to 1, over 400,000 people right now that are 50 to 64 would not be able to afford coverage. They'd actually have to drop coverage.
Now, folks, if you're on our Facebook page right now, look up at the top banner. That's what this is referencing. This is the age tax that we've heard mentioned. You may have heard it called age rating, but really it amounts to a tax.
Yeah, absolutely. You know, and you know, the pre-existing condition ban on insurance companies from charging people or from not covering people who have pre-existing conditions, that came with the Affordable Care Act. That could theoretically go away with the Affordable Care Act. The help that exists out there right now for people to be able to afford insurance there in terms of refundable tax credits and subsidies, those came with the Affordable Care Act. And we're going to talk about Medicaid in a minute, but you know, when there are a lot of folks that are in their 50s, early 60s, who have lost their job, who are between jobs, don't have access to health care. And for someone that's frankly my age, that's a problem. That's a real problem, and they need to be able to get that. And if you don't have much money, what the Affordable Care Act did is it actually expanded Medicaid to allow for people that are close to the poverty level or below the poverty level to be on Medicaid and give them some decent insurance during this time when they don't have any insurance through their employer. And so in New Jersey, for instance, that's about 400,000 people. And those folks could lose their coverage if that changes, and we'll talk about Medicaid in a second.
Yeah, well, let's talk about it right now. Why not Medicaid? So first of all, give me in a nutshell, people who don't know the difference. What is Medicaid versus Medicare?
Yeah, Medicare is insurance, guaranteed insurance for people 65 and older, and for people that have been determined to be disabled for 2 years. Okay. Medicaid traditionally has been, it started out as something for pregnant women and kids in poverty, and then for kids as well, and expanded over the time to families. But most importantly, what people don't realize is that Medicaid is the safety net for long-term care. And long-term care is not health care. Medicare doesn't cover long-term care. Long-term care is providing assistance to people for things that they have to do every day: bathing, dressing, eating, all those kinds of things that if you're disabled or if you get to be older, you lose, a lot of people lose that capacity. You need help with those activities throughout the day. Some people need it very intensively and have a lot of services in their home. A lot of people have to go to a nursing home to get those services. Right. And you know what happens is when you have to go to a nursing home and you're there, Medicare pays for just a couple weeks of it. Then you have to pay out of pocket. We're talking about typically $8,000 a month in New Jersey for nursing home care. And then if you spend all your money, which people will often do, given that it's $8,000 a month, then who pays the tab? You don't get kicked out of the nursing home. Medicaid comes in and pays the tab. So people don't realize that Medicaid is that safety net. You may think I'll never go on Medicaid, that's for poor people. The fact is that for people in nursing homes, 2/3 of people in nursing homes right now in New Jersey are on Medicaid because they don't have any money.
Well, the cost of these nursing homes, even if you're not a poor person when you go in.
Yeah, the average stay in a nursing home is 2.5 years, $250,000 right there for nursing home care. Some people have that, some people don't, but a lot of people don't. And so without that, you'd be burdening families who might not be able to afford it. And so it's really not appropriate to be looking to slash Medicaid.
What are some of the key changes that that you're hearing being kicked around right now when it comes to Medicare?
Yeah, and this is kind of like Medicare. Some of these things sound good, and what these are called is converting Medicare from a mandatory program, as it is now with guaranteed insurance, to what's called a block grant. So each state would get a certain amount of money. It's also called a capped allotment. And so instead of the federal government participating with the state government to cover and pay for services that people need, the state would simply get a certain amount of money to help continue to cover people that have been on Medicaid. What we're hearing right now is that amount of money won't last a state very long. And in fact, states like New Jersey that are really strapped with their budget are going to very quickly be looking at a real problem with their budget. They're going to have to make decisions about whether to cut people off or to reduce benefits, not to help people at home that need long-term care. Lots of things like that. We know that Governor Christie has expressed some concerns about this, about what the impact it would have on New Jersey and our state budget here. So it really does threaten that safety net that really everyone really should know about it and should know that it's there for them when they need particularly long-term care.
Absolutely. Now I know AARP being a nonpartisan organization, we're working with members of both sides of the aisle on this issue. What are some of the things that we're hoping that any new or any changes to the ACA can take into consideration?
Yeah. Number one is prescription drug costs are really leading the way as far as the cost of healthcare these days rise much higher than inflation. There's a lot we can do, both in Medicare and otherwise, to lower prescription drug costs. That's really key. This age tax. We're going to charge people 5 times as much because they're 60 instead of 20 to be able to afford insurance. AARP fought hard for that, and we're going to fight for that because, again, we're talking thousands of dollars for people. And I want to remind you, too, that things like the age tax and the pre-existing condition ban that we'll be fighting for as well, it's not just folks that are receiving health care through the exchanges, through the Affordable Care Act mechanisms. This is everybody that's out there in a small group or out there purchasing insurance on their own. So this is a broad insurance regulation that affects a whole lot of people, not people that are just on the Affordable Care Act exchange, for instance. So those two in particular are important. Making sure that the changes in Medicare that affect Medicare that we talked about don't hurt people directly, don't increase their costs, and really ultimately it's all about costs. And likewise with Medicaid, we simply can't starve it to such a degree that it's going to cause serious holes in the safety net for long-term care.
That's great. Folks, any questions, feel free to chime in right now, or if you're watching this later in the week, feel free to ask them in the comments below and we'll try to get to them. How are AARP members helping us right now as we work to protect Medicare?
Yeah, we're doing a lot. We've had hundreds of thousands of members sign petitions, contacting the president, contacting their member of Congress. We're asking members to contact their member of Congress and tell them, hey, premium support is wrong. Don't do that. Disavow that. We're asking members of Congress, and we don't want to vote on a voucher system. We want members of Congress to go to the leadership and say, we don't want this. We don't want to vote for it. We don't want to have it, period. We are asking members to attend town hall meetings. A number of members of Congress are having town hall meetings. Please do that. Respond to our action alerts. If you don't, go on to aarp.org/get involved, sign up for our email alerts, look for Jeff's posts on Facebook, and when we do those, please respond to them, because it's really the power of hundreds of thousands of people that are going to matter here. We've got major interests like the prescription drug lobby, we've got the insurance lobby, a lot of people lined up to do damage to healthcare in the United States. And if people, AARP members and others, stand up and say, no vouchers for Medicare, don't block Medicaid, block grant Medicaid, don't cut ACA or change ACA so people who are older have to pay so much more, so people with pre-existing conditions are going to find themselves out of luck. Right. We've got people, this is a time for people, even if you've never contacted an elected official, to do that. We're scheduling briefings all around the state. We've done 7 or 8 so far. We mentioned the one coming up Monday in Passaic.
Yeah, what are those details again? In case
St. Mary's Hospital in Passaic from 2 to 3:30, Monday afternoon, March the 13th. We're presenting this kind of information, giving folks ways that they can get involved with this. Of course, becoming an AARP volunteer, we have a good 300 or 400 volunteers across New Jersey. We need volunteers to help us pull off these events, to make phone calls, do all kinds of things.
Folks, just to give you some frame of reference, there's less than a dozen AARP staff members for the whole state. We really do depend on our volunteers to help amplify our message and get into every nook and cranny in the state to try to spread the message on this important issue. I will post a link to the registration page for the Passaic hearing up in the comments for this video, and also a link to the Protect Medicare action site, which is aarp.org/Protect Medicare. This is where you can go, I think, to actually send that message to your congressional leader. I know there's a few different ones out in New Jersey based on where you live. You have a specific congressman. There's also Senator Menendez, who is all of our senators. So.
Yeah, and Senator Menendez is important. You know, he is on the Senate Finance Committee, which will be considering this legislation in the next few weeks. And so he's an important member to contact to make sure that he is hearing from his constituents and knows that this matters.
Sounds great. Any last words, Brian?
No, just appreciate the chance. Again, this is the time for people to get involved. If you've never been involved in anything
doesn't get much bigger
before, this is a huge thing. And even if you're hearing all this and thinking, "Oh, this isn't going to impact me," your sons, your mother, your daughters, it's going to have a major
stuff
impact.
Happens. You never know what's going to impact you, really.
And the other thing, Jeff, to make sure people know is, as we go away from covering as many people as we can in this country, we're going to have more people uncover. It's going to cost everyone in this country that pays premiums through their employer or otherwise, it's going to cost them a lot of money.
Right.
And so, for us, for AARP, making sure that we have a good healthcare system that's affordable for people, that works for people, that provides quality care, that continues, and we continue on that direction.
Thank you, Brian.
Thank you, Joe.
Thank you, folks. And remember, keep those questions coming over the next few days, and we will be checking in and trying to get you some answers. Thank you.
Thanks.